Hello, everyone. Hi, I'm Stuart Gandalf. Welcome again to another podcast. This is our first visual podcast. We've been doing all audio up until now. So if you're on one of the usual streaming services, that's great. However, if you like, you could pop over to YouTube and see a long, long picture of me and my guest, Dean. So our video. Today, I'm interviewing, in any event, Dean Levitt. He's our VP, or he's VP of Marketing for Pawbox and an established expert in the field of email marketing. Dean, tell me a little about your background.
Sure. So as you mentioned, I'm VP of Marketing at Pawbox, which is a HIPAA-compliant email platform. I've been involved in email and email marketing in particular since way back in 2007 when I co-founded an email marketing platform called Mad Mimi. Back in 2014, GoDaddy acquired Mad Mimi, at which point I helped build out GoDaddy email marketing. So I've pretty much, or I like to think I've seen pretty much every kind of email newsletter out there, big and small, from healthcare to e-commerce, and it's something I've been obsessed with and I love chatting about. So thank you very much for having me.
Yes, absolutely. So my first comment is we just published a ebook about some of the more common things we see for HIPAA compliance and ADA compliance. And I'm sure my listeners or subscribers are going to be thinking, oh, great, another HIPAA thing for me to worry about. You know, most people would think, well, we have all these things we have to do at the office. We have to train our staff. And the idea that we have to worry about HIPAA when it comes to marketing is usually not top of mind. And now we're talking about email, yet another thing, which isn't even marketing in many people's points of view when they're talking about patient communications. So I'd like to start off by saying, yes, this is a topic you should be aware of. And no, we're not attorneys. We're not giving legal advice. So Dean is far more sophisticated at this specific issue than I am. So he'll be able to give you some advice based upon experience. But as always, check with an attorney and appropriate consultants for advice on the specific do's and don'ts for your situation. That said, Dean welcomes questions, and he is certainly an expert. So I'm going to start from the beginning. At the highest level, I would love, Dean, just to understand, what the rules are around emails to patients, right? So we're not talking about cold emails, which most people don't do cold emails anyway, it's just people. But to patients, what are some of the high level things we should be aware of to get the conversation started?
Sure. So there's really only a handful of things that matter, and if you check those boxes off early on, you can not worry. And they are simply, first of all, you need to get permission to email your patients, and this should be done right up front the moment you have a patient, the moment someone interacts with your healthcare organization. Whether it's in the notice of privacy practices, whether it's in the patient intake, get their permission to email them. And another trick, which I heard from a lawyer that specializes in healthcare compliance, is get permission for anything that you think you might need, even if you don't need it now. So that means at that point, also ask for permission to call or text those patients. And I'm talking both marketing and one-to-one. So first thing first, get permission to email them. Second thing is, if you're going to be including any PHI, and you almost always are going to be including protected health information in communication, it often happens inadvertently. So just assume you're probably going to have at some point protected health information in an email, then that email must be encrypted. And so when I say it's actually kind of easy to solve the problem rather than worrying about it, is just get all your emails encrypted if you're a covered entity or a business associate. And it's one of the things that Pawbox in particular, I'm sorry to pitch so soon, but Pawbox encrypts all emails by default, and that's simply the easiest thing to do. If all your emails are encrypted, then any PHI that's included in an email, whether it's inadvertent or deliberate, you're safe, you're compliant. So we've talked about getting permission, authorization, or consent, and there's a slight difference there, but get authorization, encrypt all your emails, and ensure the final step is ensure that your emails are encrypted at rest as well. So you can't just, it's not just about encrypting the sending of the email, it's also about encrypting the storage of that information in the email on your own servers. So that's also, oddly enough, not that difficult if you're working with something like Google Workspace or Microsoft 365. They will sign a business associate agreement. They'll ensure that your storage is compliant as well. And I guess that's probably the main advice, is just work with services that make it easy.
Okay, very good. And I do want to point out a really unique distinction that you just brought up that I think is important in case someone just read our ebook. Google will, for that product, sign a BAA. Google will not sign a BAA for Google Analytics. So very, very important distinction. And that confuses some people. So beware of that, because that matters a lot on the some other issues we've talked about. So for today then, let's drill down a little bit. And the notice of practice, HIPAA privacy, what's the specific term? Not HIPAA practice policies.
Notice of privacy practices.
Okay, thank you. So that's a long document typically. It's something that people, when they come into the office, fill out in depth. And so is that just a paragraph within as well? Is not something you have to draw their attention to specifically? They sign that little document and we're good. Is that correct in terms of the notification?
So yes and no. So for basic communication, it's enough to just say, we're going to be sending you email, phone calls, text messages. And then when you sign the overall document, or you consent that you read it and received it, that covers it. And that's for basic communication. If you're going to be doing marketing communication, and it's something we should probably get into, is what actually is marketing communication according to the privacy rule, HIPAA's privacy rule. You need explicit authorization. And it's still great to include this in the notice of privacy practices document, or a separate one. Doesn't terribly matter. At least I don't think it does. Again, check with a lawyer. But the key thing there for marketing stuff, you have to be explicit. You have to say, do you consent to receive marketing materials around this kind of topic? And the other kicker is that it must have an expiration date. So you're going to need to get authorization, say, annually. That authorization for marketing is a little bit stricter than consenting to accept the notice of privacy practices.
Great. And where would that typically be taken? On this as a separate document, or how does that typically work?
That can also be in the same document, but it needs to be its own section in the document. And it's probably, and this is just me making some inferences here. It probably warrants its own acknowledgement, whether it's a specific signature and dated as well. So it just needs to be called out specifically, even if it is part of that same document.
Okay, that makes sense. Very interesting. So the what about because I've certainly known there could be a business that's been in business for a long time and they've been emailing a general health newsletter. So I guess elaborate anything on what is marketing and what is not, but this is a good example. So I'm in urgent care and I just send out emails once a quarter to my patient base saying, it's cold and flu season, do this, it's break your arm, do that. And what's the difference between cold and flu? So these are general health knowledge. Is that marketing? Is that, and this is not tied to the patient specifically, right? So it's not saying you're at high risk of flu. It's just one of those things that goes out. Is that marketing or is that patient education? And how would that qualify? Because that's a very common.
That's a great question. And no, it's not marketing. It is considered patient education, part of treatment. But there's some things to dive in there, which I think I will in a second. But effectively, marketing is about promoting a service that isn't part of the treatment, is probably the highest level way to describe it, in which money is also going to be exchanged. So for example, general patient information is not considered marketing. But if I'm going to say, okay, well, there's this third-party medical practice in our neighborhood that offers something that's kind of related to the treatment we've done, and it's going to cost an additional $50 for that appointment, that's absolutely marketing, and you're going to need authorization for that. It's also marketing if in this general newsletter, you're advertising a service that isn't necessarily covered by the plan that you have, the health plan with that healthcare organization, with that covered entity. So there's some gray area, but in general, patient education, treatment information, that stuff is not marketing and would be considered would be covered under the general notice of privacy practices, in which you don't need explicit authorization. Just that it's a good practice to get consent to receiving these emails anyways.
Well, sorry, go ahead. You're going.
And from the canned spam perspective, you're also covered. So it's one thing that's worth mentioning from general newsletters. If you are a customer of that healthcare organization, then apart from a few details, canned spam isn't also a concern, because the consent is implied that way as well.
Right. For those, you're more expert than this or than I am, but canned spam includes, it has to be clear who the from line is from. It has to be advertised if it is an advertisement, that it is an advertisement. The fact that you have a relationship is another key thing. And what's the third? Oh, the option opt out and a physical address. Those are some of the key things with canned spam that you must have with all of your emails anyway, which is a whole separate issue. But that's intriguing. So I can, because this is important distinction. So if I'm sending out emails, like I gave an example a little while ago, these are all insurance. Now it could be that I do have, like, for example, if you did an email about mammograms, you have a device, they could come and see it for a mammogram. But if that's covered by insurance and it's a current patient, that's not really considered marketing, even though it kind of is. Okay, but you can't promote a third party. And then it sounds like cash-based is an issue. So if you're asking about, hey, like, so the same example, I'm going out and I now have an optional weight loss add-on that you can buy at our practice, that would be considered marketing if it's cash. But if it's through insurance, it's not, generally speaking.
Right. If it's for remuneration and if it's an additional cost, it can be a gray area, but let's say the safest way is to assume that's considered marketing and to get that authorization. There is a couple of things to add there. So from a permission-based action, you covered by canned spam if you're HIPAA compliant. From a technical email structure, the opt-out, the address in the footer, that kind of stuff, canned spam is separate. So they work together, but there are concerns around both of them. There is one more thing I'd like to just raise there when it comes to this general newsletter, which is it's not always clear what is and isn't PHI in the context of a general newsletter. So again, better safe than sorry is probably the best practice, because if you are sort of like a general health insurer, right? A general newsletter doesn't imply any specific treatment. But let's keep in mind things like email address, things like name, things like location. These are all considered PHI. These are identifiers. You mentioned Google Analytics earlier. The IP address is PHI. So if you are, say, a cardiologist, if you're a cancer clinic, then a general newsletter might imply that you're receiving treatment for something specific. And there again, it becomes highly subjective, and you might actually be considered to be sending PHI if someone can infer, well, Dean Levitt, who received this email from this clinic that specializes in this kind of treatment, even if it's a generalized newsletter, a general newsletter that's not specific to my actual treatment, it has a lot of implications as to the type of treatment I might have been receiving. That could and has been in the past considered to be PHI.
So that's funny you brought that up, because so essentially a general health and like a hospital chain could be doing lots of things. And so that's probably, again, I'm not giving legal advice, I'm hypothesizing here, but probably less problematic. But if you're a business that specializes in treating AIDS patients, that's more likely to be PHI, because it's very, very specific to what they would likely have. The fact of be getting anything from that vendor or that practice, correct?
Exactly. So that's correct. And there's one more twist there where I hope anyone listening has the patience to kind of go through this degree of minutia. But even that hospital chain, in order to send that email newsletter, let's say they're using one of the larger, more common email newsletter platforms. Well, the name of the recipient, the email address of that recipient is PHI. So you're still going to need a business associate agreement with that email platform, with that email newsletter platform, to just store the patient information, even if you're not going to be emailing them any PHI as well. So they're considered a business associate.
Okay, really interesting. So then you should, at the very minimum, even if you don't have a premium service like Paulbox, you'd want to be looking for someone who signs a BAA for your email service provider. Is that correct?
Yes, and you're going to need to make sure. So there's some companies will sign a BAA only for the storage, but not the sending of PHI. So if you are using any third-party service email marketing platform, and they are willing to sign a business associate agreement, triple check that that also covers the transmission of PHI and not only the storage of PHI. Because there are a number of email newsletter platforms that only their BAAs only cover the storage of PHI, but not the transmission of PHI, which means the actual emails you're sending themselves are not encrypted. Whereas Powerbox just covers them all. We're our bread and butter is encrypting emails, so we encrypt the newsletters as well.
So, okay. Going back to the notice of privacy practices, the, like let's say you're midstream and you want to be safe, and so now you have thousands of patients. Do you have to start all over with patient one, or can you send them a notice, or do you really just start rebuilding before you can use anybody? Because that could be a very common use case where you have 50,000 patients. Some of them haven't been seen in 10 years. Do you have to go back to everybody individually to get permission again, or how does that work in reality?
You do actually. It might not be what anyone really wants to hear is you will need to go back and get that authorization, which is why you should, even if you have no plans to do marketing initiatives today or this year, start getting that permission right now. There's no time like the present in order to get that authorization, whether you think you're going to need it immediately or not. What you can do, by the way, is probably, and this is more a CAN spam question than a HIPAA question, you probably can send them an email asking to be opted in, as long as there's no real marketing content in there, I think. And again, check with a lawyer about this, but that probably would be safe. However, because you're emailing patients, you still need to be covered in terms of a BAA if you're using a service to send out that email. And because you're probably communicating with someone using their name, adding personalization, that transmission should be encrypted. So the bottom line is follow the best practices both with HIPAA communication and with CAN spam communication.
So the PHA part, coming back to that, because I was thinking before that, for example, if you're mailing somebody about our diabetes program and we say, and this is good for you, that's clearly PHI, right? But even a general email about diabetes, it sounds like you can still do a general newsletter that talks about diabetes if generally, if it was a broader thing, but you still have these other issues to worry about. Am I getting this correct? I just make sure I get the nuances. I don't want to, I want our readers and subscribers and clients and to be aware of these things, not to panic, but to also take this stuff seriously. And I'm trying to get what is the reasonable person's standard here of where do you need to fall?
So let's basically say, okay, if you've got a general newsletter and and anyone can infer anything about the recipient, I'd say consider that newsletter to contain PHI. So, and I can give you some examples, again, around the Google Analytics thing, which illustrates it quite nicely. But remember, email address is PHI. Name is PHI, location is PHI, even city someone lives in. So that general newsletter might be just about seasonal healthcare or general fitness tips. But if you're leveraging something like location, if you're leveraging a name to include like dear patient Dean, then your email contains PHI. And while it might be arguable, the safest thing and frankly the only sane thing to do with the risks involved here is to just assume your emails have PHI and act accordingly, because there's another twist here between one-to-one communication and a newsletter. You've got to contact the HHS Office for Civil Rights, and you've got to get on that wall of shame if your breach includes more than 500 individuals. And the average newsletter is going to include more than 500 individuals. So sending one email newsletter that may contain PHI and could be interpreted to contain PHI, even if it's something like an email address, then you're going to end up on that wall of shame. So safety first.
Okay, that makes sense. One other question, and kind of a weeds question, but I've always wondered about. Let's go back to the provider sending out a general health newsletter. If they have opt-in, where people can opt in that are not patients, that's now becomes you're just offering a newsletter to the public, right? I'm here in Irvine, I'm a hospital, I've got a general newsletter. We can send it to patients, we can send it to the public. Does that help at all build the case? It's like, because you don't know if they're a patient or not. If there was legitimately, subscribers that are coming in that are not necessarily patients.
So the answer to that is maybe, and that's kind of the problem is you're leaving it up to some whims. And I think this is probably a good time to, I keep hinting at this Google Analytics illustrative point, and I think this might be a really good time to point it out. So one of the things that both the FTC and HHS have been cracking down on is the use of tools that capture data around the person. So the question is, okay, well, on the hospital homepage, that's an unauthorized part of the website. There's no login, there's no real information, but Google Analytics or a metapixel, this is capturing things like location and IP address. So that's been considered to be PHI, not necessarily on the homepage, but if that person visits a page about cancer, a page about AIDS medication, then that's been ruled to be PHI. And that's why the AHA and all these hospitals are currently in legal battles with the HHS around this stuff. Because think about it like this: a patient or a non-patient signs up and is receiving your general email newsletter, and they click on a link. That click is tracked, and that click is tied back to an individual who signed up. And if they clicked a link around receiving a mammogram, well, you've now got PHI. So we can say, well, the HHS and the FTC are cracking down on these very tangential identifiers. Well, they're probably going to be cracking down on that on email as well in the coming future. And that's notwithstanding state laws like Oregon and California, or Indiana, which have very strict privacy rules now at the state level. So often HIPAA is what's the word? Preemptive. Like if you're HIPAA compliant, you don't have to worry so much about the state rules. But again, the bottom line is, when it comes to healthcare, and if there's anything that can identify someone, assume it's PHI.
Okay. That's really interesting. So I could see, well, that's actually brings to another question, because we go to, and as you might expect, participate in healthcare marketing conferences and often see, your team over in the booth, Hallbox. But it's not typically email that's got everybody buzzing. It's the Google Analytics and Facebook Pixel issue is what everybody's buzzing. So is this an active area now? Are there class action lawsuits about email, or are there, big breaches being publicized, or is the FTC is even involved for this out for non-providers, or the OCR? Like, what's going on with email today? Obviously it's a big potential in the future. What's happening right now?
So if I'm remembering right, and I can take a moment and look it up, but roughly 20 to 25% of all breaches are email based.
Okay.
And these are the ones that, this is what I gleaned off looking at 2022 and 2023's breaches from the Wall of Shame, from the OCR. So email, like many of those are phishing, but many of them are simply mistakes, inadvertent inclusion of PHI in email. Now, even if you follow all best practices, breaches happen because employees do things that aren't really correct. But if you followed all the basic correct, if you've behaved appropriately, if your emails are encrypted in storage, if your emails are encrypted in transmission, if you've got the appropriate policies and procedures in-house, if you've trained your employees on this stuff, then your liability is going to be lessened, even if there is a breach anyways. But the thing is that if you look at where the states and the FTC and the HHS are going after, they're getting much more granular, because the lines are getting more blurred, as there are things like healthcare apps that aren't covered entities, things like BetterHelp. So they're going after basically anyone and everyone. Penalties are getting higher. Class action lawsuits are increasing. There's we're in the Wild West right now of punishing innocent mistakes, and it's better to be, again, assume your emails will have PHI and act accordingly.
So what about one-to-one communications with patients? Is that a special class? It's interesting. I have a doctor, I won't say who, but she was new in practice and she was said, "I'll just email me." And I said, so when I emailed her, I said, "By the way, at the start of this, I give my authorization to send this through non-secure email because I didn't want this to be a breach." She was so naive to this, she didn't know. So I just said, "P.S. You should check into this because you really." Sadly, I prefer just to email through her personal account, but you're not supposed to. So I just said I give my disclosure to do that. But there's most people are not quite that unsophisticated. But are there any special rules with one-on-one relationships, or tell me about that?
The rules are basically universal. So that doctor should not be. So you can send your PHI unencrypted. You're not liable. But if that doctor takes insurance and is a covered entity, I don't believe, and maybe a lawyer would correct him, but I don't believe you can give them permission to share your PHI in an unencrypted way, except in something like an emergency. In an emergency, there's a lot of leeway. But in general, and you actually raise a really interesting thing. Like if you emailed your doctor and said, "Hey, I forgot, is my appointment tomorrow at 1 o'clock or 2 o'clock?" And they respond, "It's at 2 o'clock." That's PHI. And if that email that they replied to is not encrypted, that's a breach. It's a violation. It's only a breach when a third party who's not authorized to view the PHI sees it, but it's still a violation. So the rules around one-to-one email communication are almost the same. If you are a covered entity or a business associate and you're sharing PHI, that PHI must be encrypted at rest and in transmission.
Got it. That makes sense. Okay. We've got a few more minutes here, and so there's a couple other things I'd like to talk about. One is the whole the time that we're recording this podcast is early 2024. The Google has come out saying it's going to be making things a lot harder for its Gmail customers for deliverability. They're in reacting to spam. I've heard, everything from, email again to like, it's not that big a deal. So like, give us a sense of deliverability issues for Google. And I think Yahoo as well also is cracking down just as a way of, stopping so many promotional emails.
Sure. So I personally don't think it's that big of a deal, and I'll share why. First of all, the rules only apply to people who send about 5,000 emails or more a day. So it's definitely around big senders who are in most cases actually the bad faith actors here. So they take liberties. So it only applies to big senders. However, I think still that's them slowly working their way towards applying these rules to everyone. There's a few key pieces, but the bottom line is if you're already a regular email marketer, you should be doing these things anyways. And if you haven't been doing these things, it's probably already been impacting your deliverability. So what are they? There's a few more granular rules there, but the key things are authenticate your sender domain. So that means set up DKIM, set up SPF records, and set up DMARC. So what they are unimportant, to be honest, but it means going to your email platform, getting a little line of code that they want you to put and go to your host, whether it's GoDaddy, whether it is whatever, Namecheap or whoever, Bluehost, and adding that line of code in a TXT record or CNAME record, and just validating that you are indeed sending from your domain, a domain that you own. So from practical purposes, that means don't send from a free@gmail.com account, send from a pro business account and get that set up appropriately. And then set up DMARC, which is a little bit more involved and requires some policies, but Google's allowing the most permissive form of DMARC. It's beyond the scope of our conversation of how to set that up and why to set that up, but there's very clear instructions, and your host and your email provider will absolutely have plenty of step-by-step documentation. All considered, getting this stuff set up should take you 10 minutes.
Got it. Okay, well, that's great. That's comforting. One thing comforting in this phone call
For
here.
sure. The other couple things are really you just want to have a one-click unsubscribe, which you should have been doing anyways, because why
Everybody
talk
has
to the
that.
recipients?
Yeah.
And the other thing is don't send spam. The spam rate is about 0.3%, which is what, like three three
That's
spam complaints out of 1,000 emails sent. And that's not that big a deal. You should already be below that. And it's been that way loosely applied for years. Back when I was working email in 2010, 2012, we were already enforcing somewhere between 0.6 and 0.3% threshold for people flagging your email as spam. So the bottom line is do follow best practices and you'll be fine.
Got it. Okay. Very good. Um, and then we talked about all this email. You kind of hit it already, but are there, give me an example of a really good HIPAA compliant email platform and what makes Pawbox compliant?
So Powerbox is, and I'm not saying this just because I work for Powerbox. It's why I work for Powerbox, is because Powerbox is hands down the best option out there for HIPAA compliant email for two very, very, very clear reasons. One, one-to-one communication. Powerbox encrypts all emails by default. So there's no chance of an employee making an inadvertent mistake. Whereas a lot of alternatives require the employee, the staff member, the covered entity, the provider to take an extra step to actually encrypt that email. So that's where actually a huge amount of HIPAA violations come from, is human error. So Powerbox removes the risk of human error. And the second thing is Powerbox emails are read in the inbox, which is almost unique. So most HIPAA compliant email providers require portals, and the adoption of portals is nightmarishly low. And especially even when it comes to email marketing, I mean, who's going to send a personalized email marketing message that requires your recipient to go to a portal, log in, receive a two-factor authentication just to read a marketing email? It's frankly ridiculous. So Powerbox emails are opened directly in the inbox like any other email. They're sent like any other email straight from your Google Workspace or Microsoft email account, and they're opened like any other email. And I think that's frankly, and by the way, their processes are patented, and that hands down, that's the only way to functionally communicate via email.
All right. So that was great. So Dean, I really enjoyed this. I was truly asking questions that I've been curious about for a long time. This is not something that um, is on the top of our radar, but it's something that we're on the periphery, and when appropriate, we just refer over to you guys. So I do appreciate your time. Is there anything we missed? Anything that's really important that our audience should know about the whole topic of email and um, uh, uh, this topic, I guess?
There's, I think, one thing just to note is for any marketing, and in particular email marketing. Email marketing it's the most effective marketing channel out there, and the ROI is generally between, depending on which study you're looking at, between $36 and $50 per every dollar spent. Email marketing is powerful, but why it's powerful is because you've got a lot of scope for personalization. And I think a lot of healthcare organizations are terrified of personalizing their communication because they're worried about HIPAA compliance. But the fact is you've got HIPAA compliant email newsletter platforms like Powerbox out there. So send highly relevant email marketing, send personalized email marketing, because doing it safely is pretty straightforward if you use a HIPAA compliant service.
All right. That makes sense, because otherwise you're just walking away from an opportunity without even trying it. Um, Actually, I do have one final question that we could go into more depth in another day. But other ways of reaching out to people include sending postcards or email or letters and text. Any comments on those? And again, I know that's deeper than we have time today, but what are your thoughts, just broadly speaking, there?
For sure. I think the next real frontier in healthcare marketing is HIPAA compliant texting. I mean, it's already broadly here, but it's very, very challenging right now. But it is definitely worth mentioning. Powerbox is working on two very, very important features. One is HIPAA compliant texting, and we're running pilots around that right now. and it should be available very soon. And the other thing is PowerBox has released HIPAA compliant forms. And why that's particularly relevant is because it allows you to capture things like patient authorization online. The form handles the data in a HIPAA compliant way, and it can feed into things like email marketing and text messaging drip campaigns and automate marketing automation. So all of these things go hand in hand. And as long as the entire ecosystem is HIPAA compliant, well, you've got a marketing engine.
Right. Very good. Well, hey, thanks for your time again. I appreciate it. And thank you for listening.
Thank you very much for having me.
Okay, so before you go, I will stop this part. We'll edit this part out. I have a question for you. I've never asked this before, but I'm worried as we're talking this through, and I'm wondering if you can help me just a little more. So I have a writer who's going to typically will take these things, condense it into a article that goes with it. What I've noticed is when we get into this kind of stuff, it's really tough for her because she has no context about legal and laws and all those things. So there's two ways you could help me if you're willing to. One is I could just send you the transcript and you could sort of highlight, through the what you think is worth carrying. Because there's some stuff we got into in the weeds that would probably confuse an average reader anyway. And that would also give an incentive to people to listen to the podcast, right? I can say, here's some that, we covered lots of ground, big issues, small issues. It's a, lively, entertaining podcast. You should actually listen to it. But here are the 6 most important things to know. So you could either do that, or you guys may have something that is really sort of 101 that we could use as a basis to write on this. Because I don't normally ask of this, but we are trying to create a relationship with you guys. This is helping you. This is you helping me is helping you essentially. So I'm wondering how you would suggest, because I could see a dozen revisions of my poor writer who doesn't really understand this stuff because she's writing about something she doesn't know about. It's tough. I've just noticed that before.
Yeah. Whichever you think will get the best outcome. I absolutely do indeed appreciate that this helps us. So I'm happy to get my hands dirty in
Well, would it be helpful to do, like, do you guys have, I'm assuming you guys could repurpose content. Well, I guess it can't be directly. Like, if we at least had a start to frame it, like some bones, we could add our own spin on it, maybe. I don't know. I'm just trying to figure out how to do this in a way that's not, this isn't core for us. This is really more as a, your sales guy I like, and I said, hey, I'll do a podcast for you guys sometime.
Right.
So it's not core to us. I don't want to make this into a monster project.
Well,
I'm trying to figure out how to make this easy for her to come up with something that's a good summary of the call.
I have a pretty good solution. I have a team of writers that are awesome and very trained and are full-time, so they can, I think they have their own sort of tone that might not suit yours, but certainly if you can get me the transcript,
let's do that then. If you're willing to do that, I'll get you the transcript. You guys write it, and then I'll come back and just make it, tweak it for tone.
Yeah.
That way I don't have to worry about it. If you're okay with that, and we'll obviously link to you guys.
I can assign that and get that done. My best writer, depending on how urgent, I have a specific writer in mind for this. It's not urgent.
It's not urgent. I would rather make this easy for both of us, and if she or he is good, it just might be a lot better. Because I'm afraid what will end up happening is I'll come back to you because this is something I definitely need your input on, because I'm not going to go put something out that's wrong. So rather than go back and forth with me, is this right? It's like, well, it's not really right. And like, oh my God, I could just see this becoming a nightmare. And if your person already knows this, they could probably write it really quickly.
Oh yeah, I'll send it to one of the writers, and she'll kick it back to me for review. She's done this kind of stuff before, and then I'll send it on. And then the only twist is she communicates in a very sort of formal phrasing, which is where most of my editing comes in. But if your writer will then edit it and take it and make it the tone that you want, then sure.
All right, let's do that then. If you're okay with that.
Totally.
I can see it becoming a nightmare. Really, yeah.
It's part of her job. She's got the time, and she's got the bandwidth.
Okay, another question for you then, before I let you go. So this is a little unrelated to this. So I have a consumer packaged goods company going after emailing pediatricians, and so they already have a house list of just opt-in, so that's easy. We're talking about buying a list of 10,000 from one of the reputable providers. There's about 70,000 pediatricians. So I'm not an attorney, but I see no issue with anything to do with HIPAA here. This package company is not a covered entity. But in terms of the deliverability, you mentioned earlier 5,000 or 10, was it 5,000 a day was the number? So
Yeah.
if they slowly prime their list, is there any need? Because there's two options. I was initially going to have the email list provider do the deployments because we were talking 70,000. Going from 6,000 to 70 is a big leap, and that's going to
You,
cause all kinds of spam filters to blow. But 10's not that much. So if I had them just, I know there's not a specific answer, but as an email marketer, because I do this, like if it were me, I'd add like 3,000 to the list and keep the opens and then add another 3,000 and
yeah.
just skip that whole process. What are your thoughts to that?
I would say go very slowly. I think your instincts are completely spot on with that. Go very slowly. The Gmail these days is very sensitive to this stuff. They've been sensitive for a long time. And technically, like, look, the bottom line is purchasing lists, no matter how like legal it is in some areas, CAN-SPAM hates it and Google hates it. So dripping them in as slowly as possible and warming up the list, and even in that first email, trying to get some sort of, look, we asked if they didn't mind us following up with them kind of text in there is just, it's also a best practice there.
But just to be clear, this is like one of the leading providers, so I'm presuming they have all that, right? This is not like some guy, because I get those emails all the time, like $500 for every doctor in America, like that's spam. But these guys charge a lot of money for this, like $1.30 per name, and
Yeah, and they get opt-in, like, can we send you this kind of content? But it's technically, and we're talking technically, it's not opt-in unless they opted in specifically to your client to receive emails from your client. So these list providers are, they're pressing their luck, and it's, while CAN-SPAM might accept it, Google is under no obligation to accept it, and certainly companies like Spam, or the block lists like Spamhaus and SpamCop, do not accept it. So
okay.
if you send to them and they report you to Spamhaus, you're going to have a hard time convincing Spamhaus to unblock that domain.
So the entire corporate domain, or is it just, yeah,
No,
so
the entire domain. So go very slowly. I might even recommend doing it from a different domain at first. Just getting that opt-in from a different domain.
like, so let's pretend the company it's not Pampers. The brand is, you have pampersdoctor.com or something. You'd pick something.
Exactly. Pampers offers, Pampers marketing, whatever.
Yeah. Well, I was thinking the other option too is to use them for deployment on the first, 4 deployments and just go after the opens. Because the
Yeah.
opens will probably be a lot less likely. So if you out of 10,000, chances are only two to 3,000, whatever, are open. Put those into the list. Is a lot safer because those are at least opening.
And just keep an eye out for the block list. Just double check your domain after every send. Just because you have to keep in mind the block lists are extremists, right? They're volunteer-based people who do this because they have a chip on their shoulder about commercial email. So just double check that.
All right, great. All right, good deal. Thank you so much. That was great. I will send it over to you. Hope you guys make lots of money off of this. We do have notable, health systems and people that it'll be everything from like some annoying guy by himself who just wants to fight with you
Yep.
to health system CEOs. Like it's a pretty broad readership. So, all right, great. Thank you.
Thank you, sir. It was really great. Cheers.